Well, now, how many people have the absolute perfectly shaped arm in America? Well, yes. Does everybody have the same size arm that I do? Okay, now, with 30% of the population overweight, do they use just one blood pressure cuff for pretty much everybody when you're checking blood pressure at the... Well, let's look at this. With 2/3 of Americans overweight, it's very important to remember that one must have the correct blood pressure cuff to measure blood pressure. If one uses a normal size adult cuff and the patient is obese, it's going to read too high. Do they ever change that? When my mom was in the hospital, it hurts her to get her blood pressure on her arm, and the nurse that was taking it took it off of her arm, says, well, I could take it on her leg. Her leg's considerably larger than her arm. And I said, do you have a different cuff? No, this is the one I brought. Well, it's not going to read accurate. What do you mean? This. Okay, so you got to understand, it's going to be different. So the cuff is important. Here's another one. Now, how should blood pressure be taken? Now, this is a lot of information on here. I didn't break up the slide. I'm going to condense it for you. First off, when you're taking blood pressure, you got to know that sleep apnea, obesity, pregnancy, oral contraceptives, other medication, emotional stress, smoking, coffee, over-the-counter drugs containing caffeine, decongestant, cold room, a full bladder, improper cuff size can all change blood pressure. Go on, say it with me. Wow, that's a lot of factors. I don't know if that's ever considered. Well, let's look at this, okay? And the arm should be elevated. You should be sitting 5 minutes before it's done. Is that ever done? Are all those questions ever asked 100% of the time that you're taking your blood pressure? No. This is even worse. Now, this is the AMA recommendations. At least 2 separate readings should be made on each visit, with as much time in between as possible. This means on different arms. And then if it's high, it needs to be checked at 3 different times of the day over a 2-week span. Is that ever done nowadays? No, not at all. So what that means is you check at 9 o'clock Monday morning and you say, Miss, it's a bit high. I'm really concerned. Did you know that improper cuff size, a full bladder, cold room, nasal decongestants, what you ate last night, all will negatively affect blood pressure or affect blood pressure. So I'm going to check it in a week. I want you to make sure you rest a lot. I want you to make sure you drink a lot of water. And we're going to check it again in a week. Because if I put you on this diuretic, the side effects are you will die earlier, but you'll die with lower blood pressure. You are going to develop kidney damage because that's what diuretics do. And they have a devastating effect to the rest of your system. And your body will adapt to this. Okay, so if you do, how many people take more than one blood pressure drug? Everybody. Do you want to know why? Is the body smart? Yeah. It sure is. And if you require higher blood pressure and you take a drug to lower it, is your body going to kick it up a notch? Yeah. Absolutely. I can explain how blood pressure drugs are related to diabetes in a second. But now, right now, is there any study that shows that lowering blood pressure adds to the length or quality of life? No. This is huge. The quality of your life right now depends on the quality of questions you're going to ask. If I say that I'm going to give you this drug and it's going to lower your blood pressure, and I get a lower blood pressure reading, does the drug work? I don't know. It depends on my question. If my question is, I want lower blood pressure, or is my question, does it add to the length or quality of your life? 2 major questions. So what they did a study. They screened 350,000 middle-aged men, and they followed them for 10 years. That's a good study. Okay? Now we're going to get somewhere. And what they found out was they divide them up into 2 groups. One group had their blood pressure and cholesterol treated with drugs. The other group didn't. And they followed them. And interesting, there was no difference in the outcome of them except for the group that was treated with blood pressure drugs. And they had a higher death rate. In point of fact, the subset of hypertensives treated with diuretics had the highest mortality rates, probably from ventricular fibrillation due to potassium depletion. That means that the heart stopped. It went into ventricular fibrillation. The people died. See, what a diuretic is It's a little bit of poison for the kidneys, and the kidneys understand that it's poisonous, so they lose that, they lose some electrolytes, and they get rid of the drug, and they lose a lot of fluid. Now, right now, how many people in this room, raise your hand if you're drinking plenty of water? Okay, so it's about half, and this is a very educated group. So now, that means half is about dehydrated. So now if you're dehydrated, do you think your blood's thin or thick? It's thick. Okay, so now if you're dehydrated, do you think that pump has to work a little bit harder? Yes, it does. What's the first drug they give for blood pressure? Diuretic. Okay, so you lose some of the fluid that initially forces the fluid down, but your body needs that higher blood pressure because either arterial damage or stress or anything else. So what's the pump going to do? It's going to work a little bit harder to get, so that doesn't work right. So then let's give a beta blocker, which will actually attach to the cells of the heart and slow it down. Does that make the person healthier or sicker? Okay, if that doesn't work, let's give a catapress. That attacks the base of the brain. Of course, last week we talked about the drugs that cause frontal lobe dementia in elderly. That's the catapress that attacks the frontal lobe. So that might not be a good outcome. But now what's interesting, in the Mr. Fit study, their goal was to get blood pressure of 140/90. And they achieved their goal. Doctor, the operation was a success, but the patient died. They achieved their blood pressure goal, but people were dying. It wasn't healthy. So they're asking the wrong question. Lowering blood pressure, does it add to the length or quality of life? That question was not asked. Does lowering the blood pressure, can you give a drug and lower it? Yeah, absolutely. Now here, more false readings. Pseudohypertension. Okay, this is another one on blood pressure cuff. Health is a result of action. Okay, disease, you can't catch a disease. But it's not random chance or bad luck. If they say that you have high blood pressure because of bad luck or bad genes, that's incorrect. Your body, unless you've had brain damage and unless you've had kidney damage, your body is a self-regulating, self-healing organism designed by God. It's designed to self-regulate.